Well, good morning, and I'm happy to be back with you today. One of the things I want to talk today is inflammation. We know that inflammation is a driving force for so many of the chronic diseases that we see today. Even things like obesity, high blood pressure, diabetes, heart disease, cancer, and many, many more. Even insomnia, depression, anxiety, all of them have at the root core excessive amounts of inflammation occurring in the body. And so you might think, where do I get inflammation from? Well, the number one source is probably foods, and foods that we decide to put in our mouth every single day. So we can make decisions before we decide to eat. Is this going to be pro-inflammatory or perhaps hopefully anti-inflammatory? And so some of the more pro-inflammatory foods include, for example, processed foods, sugary foods, things with high fructose corn syrup, what's known as trans fats and hydrogenated vegetable oils, which might be in like margarines, for example, and other shortenings and baked products. So the more we eat from like whole foods that are foods that come from the planet Earth, that are unadulterated, that are grown from our soil, generally speaking, these foods tend to be much less inflammatory. The environment can also cause a lot of inflammation in our body. So when we drink out of like the soft plastic bottles, which most of Americans still do, the chemicals that may leach out of those plastics can be troublesome. They might contain what's called phthalates and PCBs and other chemicals, but these also cause cellular inflammation. By the way, and they also may lead to autoimmunity as well. So we see people with like autoimmune diseases like Hashimoto's and Crohn's disease and various others. We do have to think about the chemical exposures that we have. But so getting back to inflammation, there are over 85,000 chemicals in our environment today, and many of these can stimulate inflammation in our body. In our office, we do measure a lot of inflammatory blood studies on our patients, and we see that they often have heightened levels when they have high blood pressure, diabetes, heart disease, cancer, and things like that, strokes, etc. So we do put people on an anti-inflammatory based diet and lifestyle. I think it's really, really important. And so we do discuss with our patients how to eat properly, how to eat healthier, and what kind of environmental things that we need to pay attention to. I mentioned plastic bottles, but even things like the pesticides, insecticides that are sometimes in our foods, those are also sources. And cleaning agents, even things we use perhaps in our bathroom or on the floors, etc., that might contain various cleaning chemicals, aren't the best for us from a standpoint of inflammation. I mean, just think when you spray some of these, I'm not going to name brands, but spray some of these chemicals on our mirror to clean it, some people start developing a cough. That's obviously due to the inflammation that may occur in the lung tissue. So anyhow, so keep in mind, the more we lean towards an anti-inflammatory based diet, lifestyle, the less risk we'll have of developing some of the most chronic diseases that we see today. And so I think it's really incumbent on all of us to start thinking in terms of living an anti-inflammatory based lifestyle and eating that type of diet.